The Delta COVID variant is highly transmissible, poses a risk, especially to those who are unvaccinated. So in today's To Your Well-Being, we're talking about COVID variants, where they stand now and in the future, who is at risk, and what we can do to help avoid a resurgence of COVID cases down the road. With us today, Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snider. We're going to talk about that Delta variant first and foremost. Is this now the dominant strain of COVID here in the U.S.?
That is correct. As of last week, it was greater than 50%, and it has a doubling rate. So I imagine towards the beginning of August or mid-August that it will be nothing but the Delta variant.
Okay, and it is here in North Carolina.
That is correct.
Okay, so they're saying that it's a more contagious strain. What makes it more contagious?
So it's a couple of things. It has to do with some of the mutations that this Delta variant has that essentially is able to not only reinfect folks who have had COVID illness, and I believe it's just the mechanism of this new variant that causes a very high viral load. And in fact, people are starting to show symptoms closer to 4 days after being exposed rather than 6 days from when we previously thought of like the COVID strain that was here last summer.
Okay, so more contagious, maybe a shorter window of when you get sick. And what about the side effects?
So that's a very good point. We sense that some studies from both India as well as in the UK that it starts out more along the lines of having a bad cold. So there's more nasal congestion and feeling under the weather rather than kind of an overt cough. There is less loss of taste and loss of smell. That used to be a very strong hallmark of having COVID-19. And we're seeing less of this with the Delta strain. So, even people who are fully vaccinated, but more so anybody that's still having any kind of this like cold-like symptoms, that still warrants getting tested, especially if you're going to be going to work or potentially, in an area where you may infect others.
Mm-hmm. Are the side effects different in the form of like the body ache thing and that kind of stuff?
I think it's a little bit too early to tell, okay. At least from the published data. We suspect that there still is that, the fatigue associated with the illness. But what we notice is that a lot of young people are getting it. So people who are unvaccinated are the most at risk of getting infected. And even when you look at the statistics in the U.S. and in North Carolina, it's a younger age group, that's leading the pack of who's getting the cases. And so it's hard to tell. Some folks are, when you're young, some people just have mild illness. And but I think it points to, if you're not vaccinated, you're most at risk of getting it.
All right, so where is your concern level with this new variant?
So I still worry that in North Carolina, we could do a lot better with getting the vaccine out and having people taking that shot in the arm. For those who are over than 65, we've done a fantastic job. Like 76% of those patients have been vaccinated. People who are over 18 and people who are over 12, it's just barely 51% of that population that's been vaccinated. So my concern is that especially people in their 40s and 50s and who may have, or folks who have underlying like respiratory illness, there is that risk of getting hospitalized from it just as much as the COVID strain that we had last summer.
All right, so you touched a little bit on it about how those who are vaccinated could possibly still get this variant. So what protection do the vaccines offer us?
Yeah, so I just wanted to clarify that a bit. So the vaccine is very efficacious. It does a fantastic job at preventing severe illness, at preventing hospitalizations. We are seeing a few people that have had a positive test after being fully vaccinated, and some of those people have had just mild disease. We've caught we've diagnosed a few people because they've had to do some testing for some preoperative procedures. But when you look at the virus quantity is very low to the point where it's not transmissible. So the vaccine is very efficacious. And studies against looking at those mRNA vaccines against the Delta strain, again, it's still it's like in the 90s. So the key thing is that we have those tools at our disposal to how to make sure that this strain doesn't, wreak havoc on our health systems.
Okay, and so what happens if folks did not go back for their second shot?
So it doesn't provide, you need to have both shots if you're doing either the Moderna or the Pfizer vaccine.
All right, and what about that J&J? Is it just as effective against this new strain?
So it does a pretty good job against the Delta strain. And the key thing is that there's many areas of getting access to the vaccine. So a lot of places can be just walk up and get that shot. And people who've been on the fence about the safety of this, the vaccine's been around for a year now, including the clinical trials. And if you think about like 160 million people that have been fully vaccinated, this by far is a very safe vaccine.
All right, so we've got the Delta variant now. Could there be more variants coming down the line?
Tanya, that's a very good question. They have identified some other strains, and the key thing of preventing viral mutations is to clamp down that transmission, right? So the more people you vaccinate in a community, you're not only protecting yourself, protecting those who can't get the vaccine quite yet, like kids under 12, and then also you're preventing that transmission of more cases and the capability of the mutations from happening.
All right, not that I want to rush summer or anything, but I think we all are looking ahead towards the start of school. We're looking towards the end of the year and holidays and things. What are you anticipating for the fall and the winter?
So if we are not picking up our vaccine uptake in our community, we will have definitely much more cases, and it will have an impact to a lot of families, right? People may not be able to go to work for a few weeks, and then and it's very highly contagious, right? So that means more people in your household who are unvaccinated, such as kids, are likely to get it. And so they'll be pulled out of school. So I think it still has we will see an impact, like higher cases in the fall. But what I'm hoping is that we still have time for a lot of people to get vaccinated and really protect our kids, right, who can't get the vaccine. And I think a lot of us are hopeful that the FDA may come out on some recommendations for kids under 12. But right now, for kids who are 12 and up, they can get the vaccine. So I would hope that parents can get out there to get their kids to get those shots.
Okay, well, Dr. Snider is going to be with us until 6 o'clock. She's going to be answering your COVID vaccine related questions. So you can text us your questions right now. The number is 336-379-5775. Remember, these are text only, so don't call. We start taking your questions coming up next.